Welcome. This is Friday, 12 p.m. Eastern Time. It is time for Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help athletes and active people like you feel, look, and perform your absolute best. Very excited to be here again. The one place that I answer medical questions. I'm not giving medical advice, as I say all the time, but I'm giving you information to help you translate what your doctor said or potentially ask better questions if you're going to an orthopedic surgeon so that you can get the information about the treatment that is best for you. It is not medical advice because I haven't seen you, I haven't examined you, I haven't looked at x-rays or MRIs. There's no doctor-patient relationship, but I am helping you try to translate that. So if you have questions, if you're watching this on YouTube, leave those in the chat, not in the comments. I can't see the comments. This gets sent to YouTube and to X and soon to many other platforms through a service called Restream, and only the chat comes through. So if you're not seeing your question get answered, leave that in the chat. For those on X, if you're trying to leave questions, sometimes those come through, sometimes they don't. So if they don't, go to my YouTube channel at Dr. David Geier, DrDavidGeier. Go down to the Ask Dr. Geier Live playlist, watch the video, leave those comments, questions, what have you, in the chat. I will stay as long as there's questions, or sometimes it is a very short show if there aren't questions. Mary, very frequent contributor on this show, says, I have a lot of grinding in my shoulder and wondering what can I do. It's tricky. It really depends on what the cause of grinding is. There is bone and cartilage changes, essentially arthritis, when you get that issue. That's tricky because there's not really great ways to definitively regrow cartilage and bone. Sometimes, and this is true if it's grinding from what we call crepitus due to an inflamed bursa, but it can also be related to abnormal tracking of the shoulder due to muscle weakness and impingement and a variety of other things. First and foremost, I am a big fan of physical therapy to strengthen the muscles around a shoulder, restore normal shoulder motion, normal kinematics of the shoulder. A lot of times that helps with grinding, but again, it gets to what the underlying issue is, and that's what's hard to know without being involved and doing a physical exam of somebody. But physical therapy is typically where I would start, depending on what some of the other causes are. Like I say, if it's an inflamed bursa, sometimes maybe, and I'm not a huge cortisone fan, but as a one-time treatment, maybe that could be helpful. If it's more of the articular cartilage arthritis type issues, you think of things like platelet-rich plasma, exosomes, especially autologous exosomes, maybe stem cells, if you feel comfortable with that, even though those are considered more experimental treatments. And then potentially surgery, again, depending on what the actual cause of the problem is. Thanks for Mary. And Mary says, shoulder replacement, not sure what's involved in that, if it works. Shoulder replacement is replacing the ball and socket basically with bone and plastic. And there's different ways to do that. There's the sort of traditional ball and socket. There's the reverse ball and socket, for basically put in layman's terms. It is very good, especially for end-stage osteoarthritis, very good at relieving pain. What it doesn't seem to be as good at is improving or restoring function back to normal. I know a lot of patients, and that's not a surgery I did. I try to help people avoid that surgery, both in my time in sports medicine and now as I've pivoted to anti-aging and regenerative medicine. But the patients that I've seen after that, a lot of times struggle with overhead activities. They struggle with activities that involve lifting heavier weights. So those, and certainly sports and certain types of exercise can be difficult, but as a pain relieving measure, thought to be very good. All right. Beauty Mistress says, just curious overall, how effective are PRP and peptide shots? So two very different questions. PRP has been studied for a lot of different conditions, and the success rates really depend on what you're testing, or what you're treating, I should say. For arthritis, this certainly as a pain relieving measure, it's been shown to be better than cortisone, better than viscosupplementation in terms of pain relief. Viscosupplementation are the hyaluronic acid injections, Synvisc, Suparts, those types of things. Better at pain relief than that. The data on restoring bone and cartilage to reverse the arthritis, not as good, but certainly would be better than cortisone, which speeds up the acceleration of that. As far as tendon and ligament healing, certainly would be better than cortisone. That would be detrimental to healing of tendon and ligaments, but the success rates really depend on what tendons and ligaments. Tennis elbow has very different success rates, say, than Achilles tendon issues. In fact, better, but it really depends on the specific injury. But there is some good results with that. Peptides, there are very few human studies. And I know I'll get comments after this, people like, oh, there's tons of studies, and those will be 5 random people that somebody says, hey, did well. That's not a real study. It's not published in medical journals. In terms of studies that have been published, mostly they're animal studies. The success rates have been good depending on the treatment for a few conditions. They haven't been studied for much. There are very few human studies related to peptides, but a lot of anecdotal data, maybe some early case series that show that they can be helpful. It depends on what peptide you're talking about, the method of delivery, and things like that. Voice texting, yeah, so I think I answered that question. Mary says, I was told it's arthritis. So yeah, that's where popping and grinding are a lot trickier, and cleanup operations to go in and smooth out the shoulder through the scope arthroscopically, and this is true with the knee too, not typically terribly helpful at certainly alleviating pain. If there's any pain relief, it's short term, but might not do all that much in terms of the grinding, catching sensations either. What's the dosing of penicillin? That's one of those medical advice questions that I can't answer. You would have to talk to your doctor that's prescribing it, but that no physician can give that information legally out online to people that aren't their patients. So if you were a patient of mine in my practice, obviously, well, you would get that from our pharmacy, but then we could do that. But I can't do that on social media. And if you find that information online, I'll be a little surprised, because again, that is not legal to do to people that aren't your patients. And unfortunately, that's true with peptides too, but it's because peptide use is so rampant with these companies and labs online selling peptides, and you know my thought on online peptides and if they're real or not. But that's why you don't see a lot of dosing information about that as well, but there's probably more. Georgia gives an update on her finger joint replacement. Doesn't look like it worked. Out of place again, not straight at all. At least there's no pain. I hate to hear that. I'll be honest, I have been involved in one of those surgeries, or maybe 2 as a resident. I don't honestly know how often they're performed, so I don't have a lot of experience in terms of the outcomes with that. It's very, very good to hear you're not having any pain with it. Jennifer, I was diagnosed with OCD of my left knee. Will a brace help on harder days? Potentially. It really depends on what stage the OCD lesion is in. And when I say not stage, may be the wrong term, but whether it's displaced or not. Is that osteochondral defect, meaning part of the bone and cartilage, is it still sitting in place, or is it detached and sort of unstable? That's probably a better way of saying it. Stable versus unstable, displaced and not displaced. If it's loose, if it's not lined up well, brace probably isn't going to do much for that. That's a lot of times something that needs surgery. But if it's in place, especially solid, and in adults, typically OCD lesions need surgery. They typically don't heal, so they ultimately need surgery. But potentially a brace might help, at least with keeping range of motion straight. To be fair, I don't know how much a brace would help with the disease process. If it helps with pain, if it helps with improved walking and other function, maybe there's a role there. I used to love those surgeries back when I was doing lots of surgeries. Just Nina, I have a fracture of the radial head. Surgery, rehab tips, how can you bring motion back to your arm? The biggest thing I'd say, the elbow gets stiff really, really, really fast. And so what I would strongly recommend, talk to the surgeon, see what range of motion, what degrees you're allowed to do, both with flexion and extension and pronation and supination, especially with pronation and supination, because that's largely what the radial head does. But also work aggressively with a physical therapist. The elbow gets really stiff really fast, and once it gets stiff over 2, 3, 4 weeks, it can be really hard, especially to get full extension back. So that would be where I would go with that. Jerry Fort, hyaluronic injections, hyaluronic acid injections, what I'm trying to say. Are they helpful for shoulder arthritis? They can be. The data is not terribly impressive for hyaluronic acid injections for any kind of arthritis, knee, hip, shoulder, but it's not harmful like cortisone, steroid injections. So that is one of the upsides. Steroid injections, as I've talked about a number of times, actually have been shown over and over again to speed up the breakdown of cartilage and bone in arthritis. So I am not a fan of steroid injections other than in very rare circumstances, or maybe bone-on-bone arthritis when it doesn't really matter at that point. So it doesn't have that issue. So if it works, the hyaluronic acid injections, yeah, then I think it's great. I would say and I did tons of that in my, prior to sort of pivoting a little bit to anti-aging and regenerative medicine, I did them with hundreds and hundreds of patients. It seemed helpful in about half of patients. It was pretty rare to have significant long-term relief where the person was great and then it would wear off in 6 months and they'd do it again. You'd see that sometimes, but a lot of times it was, it's a little bit better. It wasn't dramatically better, but it's not harmful, which is nice, and it is covered by insurance. So that, unlike PRP, unlike autologous exosomes, unlike stem cells, things like that. Jennifer says 18 millimeter osteochondral defect, lateral aspect of the medial femoral condyle. Yeah, that's the chronic or typical location. Again, and I don't know her, except other than judging by that picture. Adult onset very rarely heals. The OCD lesions that typically heal are kids where their growth plates are still open. After that, at some point, very likely it detaches and has to be replaced with a cylinder of bone and cartilage, 18 millimeters. Potentially you could take 2 smaller ones or maybe 3 smaller ones from a non-weight bearing part of the knee and put it in there, but that's bordering on getting big enough to have to get a cylinder of bone and cartilage from a donor. That's typically what is done, but it's pretty unusual in an adult for not basically conservative non-surgical treatment to work. Even being on crutches for 6 or 12 weeks, it just doesn't typically heal that often. That's what the studies show. And she says, yes, I'm 46. I do wish you great success however that goes. Keep us informed. As a lot of Georgia's frequent contributor, Mary frequent contributor on these Ask Dr. Geier Lives, I would love to hear how that progresses. All right, that looks like all the questions. We'll have a fairly short show. We are again early next month in September. I don't remember the exact week. I think it's the 13th, but check in the Ask Dr. Geier Live playlist in YouTube. It has the date of the next one. Just so you know, usually these are the last Friday of the month, but September, and I think in October they will be early as well due to a number of trips and other things I have. But very, very excited that you could join us. I hope this was helpful, and I look forward to seeing you very, very soon. Have a fantastic weekend. Take care.